Hello, you guys. It's your favorite nurse, Nurse T. Today, I wanted to speak to the nurses, the caregivers. Actually, this video is beneficial for a lot of different people. But today, I wanted to talk about compassion fatigue and burnout. Some of you may not know, but this is a syndrome that is often talked about amongst nurses. Compassion fatigue. They're burnt out. I want to say that I've been a nurse close to 20 years, and I have never experienced compassion fatigue or burnout up until this point. I do believe that I have never experienced those syndromes because I understand that the profession that I chose is a profession of servitude. It is a profession of customer service. I know that I am a service to other people. I know that the service that I will be providing to other people is compassion. So for me, is my reality. So I go to work every day knowing that this is what my job entails. So I haven't had any personal negative um, issues like compassion fatigue or burnout. And for those in the healthcare profession that may be experiencing compassion fatigue or burnout, I do recommend that you think about why you chose this highly esteemed profession. Also, remember that being in the healthcare profession allows you to serve those who once held honored positions. We have the opportunity to care for veterans and educators and politicians and people who have paved the road for us. And so, although their names may not be written in our history books, but know that we also serve heroes in different, um, they may have had different roles. But again, if you experience burnout, you're stressed out, uh, you just feel depressed and, just fatigued about going to work, I ask that you do a self evaluation on yourself. Because if you are going to work burnt out, stressed out, or fatigued, are you really beneficial to those that you're caring for? Are you really giving 100% of yourself? And honestly, as a nurse, as a healthcare professional, as a caregiver, that is what you're supposed to do. That is what we do. We do give of ourselves. We give our time, our thinking skills, our knowledge in order to help a patient receive the best outcome in whatever dynamic or whatever healthcare setting you may be in. So again, it is true that compassion fatigue and burnout is a syndrome. We do have a lot of nurses experiencing this syndrome, but in order to get over that hump. I'm just asking that you evaluate, for one, yourself. Ask yourself, why are you in this profession? What joy does it bring to you? And hopefully you can reunite with why you chose this profession that has been ranked #1 for the past 18 years as the most honored and trusted profession amongst the public. Okay, this is your girl, Nurse T, your #1 go-to nurse. And to all my healthcare professionals, regardless of your title, I hope this video has been helpful.